Hello, everyone. I'd like to introduce my good friend, Alan Ogden, but before I do, I want you to know we're here to inform and educate you on health issues and possible solutions. We're not here to treat, diagnose, cure, or prescribe anything. For those concerns, you should consult your family physician. Now, let me share why I feel so confident in learning from Alan. Alan is a pharmacist, nutritionist, researcher, genetic consultant. Alan studied at the University of Alberta, University of Denver, IHI Phoenix, Alive Academy in Vancouver, and the Research Institute sponsored by McGill University. Alan, please feel free to add anything I may have missed, and then we'll move on to the topic for today, which is pain and influence.
Inflammation.
Or inflammation, I should say. Sorry.
Well, that influences a lot of people, pain and
inflammation.
Yeah, the other thing I recently did was my pharmacy update. So I did 750 hours. You don't get a certificate for that, but you're every once in a while presented with the opportunity to do just an update program with all the new drugs. So I tried to keep abreast of that. So that's there's no certificate, but I did do my pharmacy update as well.
Well, that's great to hear.
Yeah, so I'm really excited, and I do my continuing education. So every profession has some form of continuing education to continue their licensure, whether you're active or inactive. In pharmacy, it's 15 hours a year. If you're inactive, 30 hours a year if you're active. So I do, I probably do about 50 hours or more a year of continuing education as well.
Yeah, we have the same thing for professional engineers.
Yeah.
You know. So anyways, I have a list of questions I'd like you to answer for us today. We hear a lot about inflammation being the cause of all disease. And can you explain that and what the science is behind it? I'll go through all the questions. And I hear inflammation can really affect sleep. And what about CBD and THC and all, how does that affect pain and inflammation? And why do some people respond to pain relievers better than others? And what is, and one person had a question regarding what does a narcotic naive means. So those are the questions I have at this time.
Okay.
So please go ahead.
Well, thank you. I will, I'll do my best. So I think the place to start for everyone listening to this, we're inundated with advertisements about reducing inflammation. You got to reduce inflammation, and there's this product and that product, and you got to get the latest. I just saw, I actually opened this ad on a social media site. They have the latest and greatest, and for just $490 US for a month's supply, you can get this latest and greatest fighter of inflammation. And it's almost as if we don't have anything to fight inflammation in our body. It's like it's kind of a forgotten thing that we made it this long. We've made it through a lot of centuries, and we're still here. So just a basic understanding of what inflammation is, and there's two kinds of inflammation. So first is a normal inflammatory response. Now, people need to understand we cannot live inflammation-free. That's an impossibility. Our body would not survive if we were inflammation-free because it's our first line of defense in trauma, in any kind of bacterial invasion, viral invasion, any toxin that we're exposed to. The very first thing is we're going to get inflammation somewhere. Now, if we hammer our thumb, the inflammation is going to be very visible. I mean, we're going to get immediate pain. We're probably going to use language we didn't know we had for a minute or two until we kind of get in our brain that we actually hit our thumb, and call ourselves all sorts of names for doing that. And then it's going to swell. And that swelling is a normal process. And where it's most visible is if you have a toddler people, their toddler, it's taking its first steps. If it happens to fall and bang their head, they'll get a goosebump. They'll get just a huge goosebump. And often parents will just panic about this goosebump. But that's just a signal to me that their inflammatory response, which is an immune-directed response, is working very well. And you'll see that that goosebump will go down very quickly. It won't stay there for even, it's maybe a half an hour, a few minutes, it starts to recede, and then you will have, bump and redness. So the redness, the swelling, the pain. So normal inflammatory response will trigger all of our defensive mechanisms in our body. We'll even sweat a little bit because our skin is the largest organ, and it's one of the main ways we detox our body. So if we're exposed, say, to a toxic chemical, it would be a real good idea if the pores of our skin opened up and we have water in our body and we can flush it out through our skin. And people will notice that sometimes, even if they're taking a very strong iron supplement and they lick their finger, they'll go, tastes like iron. Or if they're taking some kinds of antibiotics, they can taste them on their skin because they're being excreted through the skin. We use about 1 liter of water every night to excrete different things through our skin, get rid of toxins and even excess minerals, excess vitamins, excess amino acids through our skin. So it's a very efficient way for our body to do that. Lots of surface area, very efficient way. So in an inflammatory response, we'll get sweating. We'll often get nauseated because the blood rushes from our internal organs where it's usually collecting to make sure that we have adequate blood for our heart and gallbladder or liver, the things that we use on a continual basis. Blood rushes to an extremity and we will feel a little bit of nausea, might feel a little bit of dizziness as the blood sort of drains from our brain as well to go fight this inflammation. And so there's a lot of responses, and those are normal responses in our body. And most of those will last for a few days, sometimes a few minutes. Like if it's a mosquito bite, it might be, just a few minutes and then it starts to recede. If it's trauma, it may take some time. Where we run into the problem, so just before I leave that, that's an inflammation that we want to control, but we really don't want to aggressively treat that unless it's interfering with our life in a way. So after surgery, of course, we'll use painkillers, we'll use things. So it takes your mind off of the pain and inflammatory response, and you can rest and heal. What is the challenge long-term is what's called chronic inflammation. Now, chronic inflammation is when our immune system has reached a point where it literally can't handle anymore. It's doing its best, but it's kind of being overridden by the inflammatory response. So that could result in things we don't notice. So we could have internal swelling. We could have hardening of the arteries. We don't even know that we have that, but that's actually inflammation. We could have sore joints. We could have other things that we just think are normal. And in Canada, once you reach the age of 80, you become what's called a geriatric patient. And along with being a geriatric patient comes the assumption that you're going to have something that's, you're going to have lack of mobility, you're going to have pain in your joints, you're going to have all these things, but that isn't normal. Those are actually signs that our immune system is not running correctly, and there's things we can do about that and help with quality of life. So this chronic inflammation is what we want to talk about today. And that's something that we have to really get on top of. I was at a seminar just last week, and it was attended by a host of different disciplines. So there was cardiologists, there was people from diabetic clinics, there was functional medicine, naturopaths, there was even some chiropractors, because chiropractors, when they do a manipulation, one of the purposes of that is to reduce stress on the spinal cord. We can have inflammation in our spinal cord without really knowing it. We release that and into the nerves and so on. So we had this whole host of these people speaking about different categories of what they do and so on, but they all came to the same conclusion. And you mentioned that in 2004 the first time, and then later 2012 a repeat. Time magazine did run an article saying inflammation is the cause of all disease. Now, I don't think that at the time that was just, oh, wow, that's incredible. I don't think inflammation is the cause of the disease, but it's certainly underlying every disease. And that's what all of these practitioners agreed on, whether they're from cardiology, diabetes, whatever their practice was. At the base of their treatment modality was, we need to fight inflammation. We need to check our inflammatory markers, and we have really good tools to do that now. So we can check things like C-reactive protein. That's a definite marker of inflammation in our body. And this inflammation that's subclinical, we might not know about it, but if we get a blood test and our C-reactive protein is high, there's inflammation happening. Our triglycerides is another one. High cholesterol is actually a sign of inflammation in our cardiovascular system. Cholesterol was incorrectly, many years ago, blamed for cardiovascular disease. We now find out that the extra fat that's floating around in our cardiovascular system is a sign of other things, including an inflammatory response in our cardiovascular system. So when you get damage in your cardiovascular system, you can't just go put a Band-Aid on it like you can in your skin. So our body produces a layer of fat and puts it in there. And so this long-term inflammatory response, we really need to get on top of that. So when we're looking at inflammation, what we wanted to do at Modexus is we wanted to look at how does the body actually handle inflammation, and can we duplicate or encourage the natural response to inflammation in our body. Now, am I making sense so far? You can interrupt me if I'm losing you here anywhere.
No, you're making sense. And then when you explain the inflammation, explain how the pain of that works.
Sure. Yeah. So when we get an inflammatory, so if we get a trauma of any kind, so if it's a bacterial viral trauma, the pain is usually fever. So that manifests as headache. It can manifest as muscle aches. Some kind of ache is usually associated with a microbial type of inflammatory or invader, and that inflammation from that is usually fever, sweating, muscle and aches like that. When we get a trauma, so when we damage something like break a bone, hit our thumb, we send a signal to our brain that says, wow, this is really happening down here, and we need lots of help. And the way that we get that is we send a signal up our nerves, goes to our brain, registers there. So we actually don't feel the pain in our thumb at the start. It goes up and it triggers a reaction in our brain that says, okay, respond. And we respond with this feeling of pain. So it's a neurological response, sends a message down our nerves saying, and the nerves then are a measure of how much trauma is happening in our body at that particular location. So the pain response is actually sort of a marker for how much help our body is going to need in fighting the inflammatory or the trauma and the inflammation from that trauma response. So when we looked at putting products together, we wanted to look at how does pain happen, right? And is there a way to actually help encourage that response and then reduce that response? Because sometimes when we're in pain for a long time, we can get used to it. In a sense, our brain goes, okay, it's just there. I'm not going to respond like I should. And so then we get this chronic sort of thing. and we're not getting the same response. So that's something that we want to keep that sharp if we can, because that marker then tells us how aggressively we need to treat something. You think about a heart attack, for instance, severe pain with that. Why? Because it's life-threatening, right? So the way our body gets our attention, severe pain. That's the way it does that. So we wanted to look at that. And in that, we found that there's not only this immunological response, but backing that immunological response is something called the endocannabinoid system. Now, the endocannabinoid system has got a lot of publicity and media attention recently with the development of CBD, THC, these things that act directly on the cannabinoid system. So just to help people understand what the cannabinoid system is, it's literally sort of a mirror image of your immune system. It actually has an effect in similar ways in our body. It has an effect in our brain. It has an effect on our spinal cord. It has an effect on our muscles. It has a very similar effect to our immune system. So I like to think of it as being a backup system to our immune system. And that's why people with chronic ailments where their immune system is really failing them, if they can actually trigger the cannabinoid system, then it's like they're inadvertently boosting their immune system. It's a different system, but because it actually affects the same areas, it's like, oh gosh, that helps. So it helps my depression, that helps my pain, that helps my headaches, that helps all these things. But it's actually doing that in conjunction with your immune system. So it's a really good system. And so when we put these products together, there's a couple of things we wanted to do. One is we wanted to know if there's a way we could actually engage the endocannabinoid system without using those restricted materials, CBD and THC. They're restricted in a lot of areas. Could we do that without doing that? And could we, you already mentioned there's people who don't respond to painkillers. Now, on about 90% of those people, that's actually a genetic, what we call a SNP. So they don't have the genetics to actually take a painkiller like ibuprofen. So when you take an ibuprofen or a Tylenol or an opioid, it goes to your liver. The liver then actually puts that through a chemical process and changes that into a new chemical. And that chemical is actually what has the activity in the body. If we don't have the genetics to do that, that's called methylation or acylation. If we don't have the genetics to do that, then some people can, they can take a lot of pain medication that has zero effect because their liver literally can't make it. They can't methylate it, doesn't make those metabolites, doesn't have any effect. And when you say somebody is narcotic naive, it's just saying that they can take narcotics, right? And they don't have any real response. People like when I was in my practice, people we would put them on a pump, right? And they could take morphine at any time they wanted. And some people, they would be pumping that every 20 minutes and they're not getting anything. So they just don't have the ability. They don't have the genetics to actually take that and make it into a useful drug in their body. Does that make sense?
Yeah. I mean, my wife has that same issue. She doesn't respond to any type of painkiller. Now, is there anything for people that don't have that ability, or genetics to find a way to resolve pain?
Well, yeah. So before I get into that, I know we have another gentleman on here, and his name is Rick McCrew. He's a good friend of ours, and Rick, I want you to just tell your story about your experience in using what we've made, and then I'll explain what we've done and why that has the ability to maybe help some of these people that are narcotic naive, don't respond to painkillers. And so, Rick, if you're there.
Hi there. Can you hear me?
Sure.
Yes,
we can hear you and see you.
Okay, good. Hey, well, what I did, I had some issues a while back with some kidney stones that they had to go in and actually laser them out. And afterwards, there was quite a lot of pain involved. So the doctor gave me narcotics to take. I'm a retired nurse, so I know, narcotics, in my opinion, if you take too many of them, it's going to end up getting worse, in my opinion, because you're going to get constipated and then you're going to have a different kind of pain. So what I did was basically I just took the Aleve or not Aleve, the Relieve, and I took 3 of them at a time and just went through the day with that, and it helped to relieve my pain, made it manageable during the day. When I got to nighttime, where I knew I wanted to get a good night's rest, I would take a half of a dose of the narcotic along with 3 more Relieve, and then also I took a Tranquility with that as well, and it just helped relax me. And I slept through the night, really great, just taking that. And it also helped me, it prevented, the constipation issues that narcotics gave me. So
that's awesome. Yeah. So you actually mentioned 2 products there. You mentioned Relieve, which is the pain product that we've made. And you also mentioned Tranquility. So I'm going to talk about both of those because they both are designed to have an effect on pain and inflammation. So that's really great. Thank you for that, Rick. We're going to try to change the screen here so we can get me back up here if we can. I'm not sure how to just see if we can do that. There we go. Well, there it should have been. I'm doing this with my thumb on my phone, so it's like it's very interesting, right? Oh, well, we'll just leave me.
You're the main one on.
We'll just leave it as it is. Anyway.
Yeah, I can see all 3 of us on my computer screen.
Yeah. So this one should work if I do it right. No, it didn't. Anyway, it doesn't matter. You can see all 3 of us. It doesn't really matter. If you want to turn your camera off, Rick, if you don't want to be on, you can just turn your camera off and you're not. Good. Yeah. There we go. So thanks for that, Rick. You can still see Al and Al here. So what we looked at is, can we do something? Can we find a bunch of ingredients that would stimulate this endocannabinoid system and actually also have a direct effect on the pain mechanism? So when we look at painkillers in the body, painkillers, actually what painkillers do is they block that nerve function, right? So there's different pathways. There's the COX-1, COX-2. So when you take a non-steroidal anti-inflammatory, it's blocking the COX-2 pain pathway. Tylenol blocks the PATH-1. The only difference between those is the Tylenol pathway is more geared towards fever, so that the pain that comes from, a microbial sort of invader, the fever, maybe nausea, all of that's a little easier on your gastrointestinal system. And then the others, they have more effect on the trauma type of pain. So they work on a different system, which is more geared to the trauma pain. So they just block that. They just entirely block that off. And what we wanted to do was actually use ingredients that we know will increase your body's ability to reduce inflammation, reduce the reaction that's going on in your body. So with every trauma, our body goes into what's called fight or flight, and it'll stay there. So chronic inflammation means our body is actually in a chronic inflammatory state. And that's not what we want, really. That's something that we want to tone that down. That means when we're in a chronic inflammatory state, a chronic fight or flight, our cortisol is raised. So that's where Tranquility comes in. So the ingredients in Tranquility are meant to reduce that fight or flight, that cortisol response. They also have ingredients in them. He mentioned he was taking them at night. They have ingredients in them actually for insomnia to help you fall asleep. And so that is a really useful thing when you are suffering from pain, is to have something that will help you fall asleep. Often people can't fall asleep when they have pain. So taking a couple of Relieve, like you said, along with the Tranquility, is a dynamic duo combo to actually make that happen. So in the other, we have an ingredient called garlic, and people don't often think of garlic as a painkiller, but garlic actually contributes a sulfur molecule. And sulfur is something that really increases our immune response. A small amount of sulfur will help in the production of 3 different ingredients that are used to reduce reactive oxygen species. So reactive oxygen species are what actually our body send, like when our body starts to repair and we start to rebuild, we're tearing proteins down, we're rebuilding proteins. There's a lot of this excess oxygen that's released. And if it's not taken care of, it actually will increase the pain, it'll increase the swelling. So reactive oxygen species are necessary. We can't avoid that because we're making protein. Every time we make protein, every time we have cellular development, we're creating reactive oxygen species. So we want to reduce that. So a little bit of sulfur actually encourages that. It also is really helpful in the liver for recycling glutathione, and glutathione is the mother of the inflammatory response. So we have that in there. We also have something called Lonicera longevity and maki berry. Now, those Lonicera longevity is the highest in polyphenols. There's a variety of them, anthocyanins being some of them, but it's the highest in polyphenols of any berry on the planet. Lonicera berry is native to Canada. It hasn't been used by any. We're the only people that use it for its actual benefits for the cardiovascular system. It has benefits in preventing a lot of inflammatory type diseases and perhaps even cancer, which there's cancer. I heard that on my seminar, that cancer has a lot of inflammatory markers that go along with that. And so Lonicera berry, it's kind of the standard in the industry is the blueberry, and blueberries, they have about 300 micrograms per 100 grams of these polyphenols, where Lonicera berry actually has about 4 times that, almost 1,200 micrograms per 100 grams. So it's much stronger in its benefits. And it has a direct impact on calming, like a calming effect on the cardiovascular system, opening up the cardiovascular system so you can get more blood flow. There's in the polyphenol area, there's so many ingredients. There's about 44,000 different polyphenols that are available. Many of them we don't really know if they have any positive effect on the body. There's been about 4,000 researched, and the ones that do in Lonicera berry, they have this direct effect on like calming down the immune function, calming down the nerve response, etc. So Lonicera berry is in both of these, and maki berry, excuse me, maki berry has it's been used for years. It was the tonic. It was like the tonic. If you had anything going on, maki berry, if you lived in those countries where maki berry was available, it was the tonic for everything. So it's an adaptogen type of berry, and it just has it has the ability to sort of evaluate what's going on in your body and then work with whatever system is being weakened by whatever's going on. That's what adaptogens do. So we have these 2 berries in there. They're very, very good. And together they make a really dynamite combination. The other thing we have is we have something called centramin in there. And centramin is from Utah. It's from out in the mountains in Utah. And it's a multi-mineral compound. So it's just minerals. It's 75 different trace minerals. So things like things that people don't think of, molybdenum, lots of different micro minerals that we don't even think of. But centramin, we put centramin in there. And what these micro minerals do in our body is they're actually catalysts. So every reaction in our body needs a catalyst. So things don't happen by accident in our body. Let's just say that nothing happens by accident. There's always some trigger mechanism to everything. So when we have a trauma and we get an inflammatory response, there's something that triggers that. So we need these micro minerals to be catalysts to actually stimulate things like the what's called the NRF2 reaction. NRF2 is the all hands on deck. Every possible defense mechanism in our body is called into action. It's not that we might need all of those defense mechanisms, but they're all called into action. And then, eventually we're just down to using what we need as far as our defense mechanism. So it's a brief sort of call to action by everything in the body. And it doesn't last very long. That particular reaction doesn't last very long. But these micro minerals, so for instance, the activating glutathione requires a trigger, and that can be selenium. Selenium is in both Lonicera berry and it's also in the centramin. So you can have all the amino acids to make glutathione floating around in the body, even attaching to the receptor sites. We have receptor sites on our cells for these amino acids that could all be there, but we still need that little catalyst, that little spark to make the enzymes work, to make everything happen. So we put centramin in there to do that. And so, these are really, really great products. In Tranquility, we actually put three ingredients in there that are directed at insomnia. And in the Relieve, all of the ingredients that are in there are meant to either encourage the immune response or to encourage that endocannabinoid response. Now, one of the really cool things, and I'll just kind of close with this, but one of the really neat things about when you stimulated the endocannabinoid system. So if you're somebody who's been prescribed CBD, lots of people, it takes them several weeks for that to actually have its full effect. And part of that is we don't have the metabolites to really use that new ingredient yet. So we have to develop a system to develop those metabolites. Our liver has to catch up so we can do that. So it can take, I know like the main clinic here that's authorized by Health Canada to supply CBD to first responders and the military and so on. They tell people, listen, you're going to start on this. It could be 8 weeks before you get any response. Well, if you're in a lot of pain, 8 weeks is a long, long time. So yep. It's just too long. So in Relieve, we put things that have like the garlic and so on. They have an immediate effect on the systems that are going to help reduce inflammation, help reduce the pain, help reduce that response. And then as we stimulate that endocannabinoid system in a natural way, not that CBD isn't natural, but we don't put anything that's sort of uncharacteristic, that's unusual to our body in Relieve. So those can act right away. And over time, you'll get a better response from Relieve. So like Rick was mentioning with that, severe pain, he was using 3 capsules a couple times a day. And I was just talking to somebody yesterday. They had dental work done. Now, if you can believe this just blew me away. They had dental work done, and they had a root canal done. They controlled all that pain just with Relieve. They only took Relieve. They didn't take any other painkiller than Relieve.
Wow.
So they took 2 capsules 3 times a day, and then consistently. And then he actually did, on the first night, he took a little bit more before he went to bed. He took another 2 capsules, but went back to, here's the other story about that. He also combined it with Tranquility at night. He went back, he had to go back to the dentist in 3 days. They wanted to check and make sure everything was okay and it was healing. And he said, when the dentist looked in his mouth, he said, "What have you been doing?" And he said, "Why?" He says, "Well, I've never seen any healing like this." And so that's impressive. Yeah, he just couldn't be on. He wanted to come on here today, but he just, the timing didn't work. So, but he wanted me to tell a story. So to just to explain to people why that happened, you've got anybody knows, if you get a cut in your mouth, it bleeds like crazy, or your nose bleeds like, you've got so much vascularity to your mouth. And if you cut your tongue, it heals like, it doesn't take maybe minutes. Your tongue is already started healing. There's just so much blood flow. One of the things that I think happened is because it stimulated the production of glutathione, or helped in the production of glutathione, which is very healing, helped in stimulating this reduction in the overall trauma response. The body was able to heal a lot faster, and that's just a measure of just there was so much blood flow there, and he just kept on it, and got that healing response. So that's a really good thing. The other thing, I didn't tell him this, but the other thing is there's an ingredient in both of these. There's a single ingredient in both of these that actually helps with skin repair. So that would have something to do with it as well. So relieve, tranquility, fighting inflammation. These are great. I don't want to underestimate. Everything I start with is the longevity product, the glutathione product. So that's the very first thing. And actually, that's one of the things that these doctors mentioned on the weekend. Although they didn't tell people how to do it, but every doctor mentioned that optimizing glutathione. There was one doctor on there who's very well known for promoting glutathione, Dr. Hyman. He's very well known for that. But they didn't. He just mentioned that, but he didn't tell people how to do it. And of course, we have the dual form glutathione in longevity, which increases your glutathione. Recycling your glutathione also helps to boost intracellular glutathione production. So, first off, we start with longevity. That's a starting point for everything. And then, you can add relief for the pain. You can add tranquility for the sleep. And you asked me at the start, why does inflammation affect your sleep? And it's because your cortisol won't go down. And as long as your cortisol is up and it's keeping your body in that fight or flight method, you don't produce as much melatonin, you don't produce as much sleep chemicals. So once we use tranquility and reduce the cortisol, get it down, then we can fall asleep. So inflammation does definitely affect sleep. That's one of the problems we have with people with chronic ailments all the time. They need to sleep, they can't sleep. If we could get them to sleep, they might be able to heal a lot faster. So we can do that with relief and tranquility. Anyway, thank you for listening.
Well, thanks for your information. I one Saturday I was working, and I've been pretty inactive because of my illness, and so I've kind of lost a lot of muscle and stuff over the 3 or 4 months. And then I started working. So one Saturday I was working on the deck, and so I finished around supper time, and then went and had supper and then a shower. And when it came to bedtime, my upper back and shoulders were just aching in pain. And I thought, man, if it already hurts now, just imagine what it's going to be like tomorrow morning, right? Yeah. So I took 4 Relief that night just before I went to bed. And the next morning I woke up and I had no pain whatsoever. I was just thought, okay, this stuff actually works.
Yeah.
Now, so I figure, okay, if you overdo it on exercise or working and take it some before you go to bed. I mean, I think people got to try it out for themselves as to what works. But I know for me that taking that 4 that night was great, because next morning I thought, because usually it's the next day that you pay for, if you overwork your muscles, it's the next day and even the following day where you're stiff and sore. And I had no stiffness, no soreness whatsoever.
Yeah, that's so true, because when you stress your muscle, you break down the muscle, right? When you're working it out, you break it down. And then, it's the recovery, right? It's getting rid of the lactic acid. It's getting rid of all the dead material. And sometimes that can take a couple of days. And you're exactly right. Now you've encouraged that whole response by, encouraging the endocannabinoid system, by encouraging your glutathione production. All of that helps with recovery for sure.
I know.
Now, is there any negative effects from taking any of these products, or can you take it with medication or anything else like that?
Yeah, Rick had a comment there. Just go ahead, Rick. Just make whatever comment that was. You were going to say something.
Okay, I'm sorry to barge in, but I just wanted to agree with what you were saying, Al. I work out, I ride my bike a lot. I'm on my total gym. I'm 72 years young, but I stay active. But a lot of times after my workout, I just routinely take a couple relief and don't give the pain a chance to, raise its dirty head on me. And it's helped a lot.
Thank you. Yeah.
That's great.
So to answer your question, we already heard Rick talking about having, combining with a narcotic painkiller with his kidney stone. There's no known drug interactions literally with any of the products in the Modexus family. So there's certainly nothing in relief that would interfere with a medication that you're taking for pain. There's nothing in tranquility that would interfere with a medication that you're taking for sleep, for instance. And then, longevity, what longevity can contribute to this whole thing is, once again, we talked about the metabolites. So every drug has to be changed into something else in order for it to have activity in the body. And then it has to be cleared out of the body. And that's, once again, the liver has to do that. So, with the Lonicera longevity, you've got milk thistle. Milk thistle is known to increase the activity of the liver, help the enzymes there. So you get better clearance of leftover material. So lots of times when people, do what the body does naturally, which is what the intention behind these products are. So when you take something that's unnatural, like a drug, often you can take less of it and get the similar effect because you don't need as much, and then you don't get the side effects from it. And I don't know why they're called side effects, because they're actual effects. I mean, they're documented effects. They're just, we give people a drug, we say this is a painkiller. Well, that's its major effect. All the other effects are all effects. They're just called side effects as if they're immaterial. But no, they're effects of the drug as well, whatever you're feeling. So you can take lower doses and clear them out faster. That's always a good thing as well.
Can you overdose on this?
No. You could literally take, I just got to do the calculation in my head here. You could take about, the thing that would happen is you took, let's say somebody accidentally took a half a bottle of Relieve, or intentionally took half a bottle of Relieve. The only thing you probably would get is you'd have to hurry to the washroom. Garlic is used in other, garlic is used in a lot of cardiovascular, a lot of functional medicine doctors will use garlic at about 900 times the amount that we are using it in Relieve. So I don't think there's no known or documented adverse effects with these products.
Well, that's great to hear.